Hi, this is Mariquita Fuller, and I wanted to talk to you a little bit today about motivational interviewing. Many may have heard about motivational interviewing, but really aren't sure about what it is. Feel free to come. I have a weekly webinar in which I'll talk more about it and give you a live example and give you an example to really see what it is and how it can be effective. Motivational interviewing is a way in which you really can help a client be able to explore and resolve their own ambivalence and help move them toward making a behavior change. It is client-centered, but it is also somewhat directive, and that is why it is kind of an interesting approach, because it doesn't follow simply Carl Rogers' theory of following, but it really follows more into a guiding philosophy and moves away from the typical provider healthcare approach of being directive or authoritative. One of the interesting things is that when you think about people and change, none of us want to be told what we should do. And in fact, the more that you are told what you should be doing, the more that you are going to resist making any change. So one of the things I like to remind people as they're starting to be exposed to motivational interviewing is that you can actually be creating or causing damage to your client by using an authoritative, directive approach or continuing to argue for change. The more that you confront a client, the more that they will be less likely to change, and you may even push them in the opposite direction so that they will resist change and change far less quicker than they might have if you had left them alone in the first place. So it's very important to realize that we do have an important role when working with someone, with the words we choose, the tone we use, the style in which we talk to someone can either be an effective tool to helping someone resolve their own ambivalence and really decide what they want to do to make a change in their life, or we can confront them, give them advice, chastise them, tell them what they should be doing, and pretty much ensure by using those techniques that the client will not change their behavior, which will continue to put us in a cycle of feeling frustrated and angry because it never seems to make any difference what we do. No one seems to make a change. I think when you talk about someone who smokes, most people who smoke know they shouldn't be smoking. They know all the bad side effects. They've seen it. Anyone exposed to a television or the media knows that smoking is harmful to your health. So continuing to provide education or tell someone all the evil effects of smoking probably isn't going to make them put down a cigarette. How many times have we seen someone continue to smoke whose spouse may have passed away from lung cancer, or they may even be smoking while they're on oxygen? It is because it is an addictive behavior. If it were that simple to do, anyone could just put down a cigarette. It's much more than just simply saying, I know I shouldn't do it, so I'm not going to do it. And that is where motivational interviewing is very effective. It allows you to stay in the spirit of motivational interviewing, which is trying to be collaborative with the client, trying to evoke from them what it is that they're wanting to do, what's important to them, and always rolling with resistance. So when a client starts giving you what may appear to be resistant talk, you automatically back away from it, because truly in motivational interviewing, resistance is not seen as a negative. It's not seen as the client being non-compliant or being difficult or being challenging. It's simply what occurs within the dialogue as you begin to heighten their discrepancy toward thinking about change, it will allow the person to perhaps at times feel uncomfortable, which may have them put up some resistance or some defensiveness. The key with motivational interviewing is not to push against that, but rather redirect and move into another direction. So I hope that this helps a little bit in giving you an idea of motivational interviewing. I would look forward to having you participate in our weekly webinar and hearing some of the live examples that we will be sharing as we move forward. Thank you.